ovarian cancer. So women with one of two gene mutations associated with increased risk of ovarian and breast cancer can improve their chance of long-term survival if they remove their ovaries by age 35. It's a Canadian study from the University of Toronto tracked 5,800 women with BRCA1 or BRCA2 mutation for as long as 19 years. Those without cancer were enrolled in the study and underwent surgery to remove their ovaries to reduce their risk of ovarian cancer. The idea was to reduce the risk of ovarian cancer by high numbers. Those who had BRCA1 mutations and who had surgery at 35 reduced their lifetime risk of ovarian cancer by about 99%, down to 1%, the same as among women who didn't have the mutation. So they're recommending that if you want to reduce your risk of getting cancer or dying of ovarian cancer, the optimum age would be 35. Now, it's not so easy because for women, it means that they'd be going through sudden menopause at 35. When the ovarian tissues are removed, the source of estrogens are removed, and so women have a sudden onset of menopause, which is not so easy. There are side effects to that. Now, this study was published in the Journal of Clinical Oncology, and it's the first time that shows that women who remove their ovaries with the mutations can reduce their risk of dying from any cause. The women were from Canada, United States, and several European countries. They were followed for an average of 5.6 years. There were 5,700 women. 2,100 had the surgery when they were enrolled, and another 1,300 had it in follow-up. And in comparison, there were 2,200 women who did not have the procedure. Altogether, 186 women had ovarian or other cancers, and 68 died. So what's the issue here? Well, in America, there's more than 200,000 women with breast cancer. Now, they're not all genetically related. In fact, the minority are genetically related. In the United States, there's 22,000 cases of ovarian cancer and about 14,000 deaths. So we're trying to reduce the risk of cancer and cancer death. The mutations in BRCA1 and BRCA2 generally run in families, but some families don't know about it, and they account for about 5 to 10% of breast cancers and about 15% of ovarian cancers. So it seems to show that there is a way to reduce the risk of cancer in these BRCA1 and BRCA2 families, and it's obviously best to speak to your physician about that. Look at the study. The study was published this week, and we know that the risk of dying from ovarian cancer and developing ovarian cancer increases in the 40s. Up to 50 years old, it goes to 14%. So there are things that can be done. It's not so easy, but it's great to know that there's treatments that can improve your chance of living a normal length of life. And I want to talk about a patient who came to us. Wow, what a story, what a story. 84-year-old woman. She has 2 children and a loving husband. They all came to me this week. She had pain in her upper abdomen. She had a questionable gallstone. She was taken to the hospital. She had an MRI, which showed a mass in the pancreas. So the doctors at a big hospital tried to put a scope in her stomach to biopsy the pancreas cancer, and it perforated her duodenum. When you perforate your intestines, all the juices and all the materials from the intestinal tract leak into the otherwise normally sterile abdominal cavity, and wow, was she sick. She was hospitalized 6 weeks, nearly died. She was septic, she was jaundiced, she lost a lot of weight, she was really weak. She went to a couple other hospitals, famous hospitals in Baltimore and in Philadelphia for second opinions, and they pushed her away. They told her, go home, get stronger. Well, how do you get stronger when you have a pancreas cancer eating away at you, causing pain, causing suffering, and the workup caused perforation of her intestine? Wow. Then she got sick again with abscesses in the liver and was hospitalized again. She was given fluids to get better, and so much fluids in the hospital, she went into congestive heart failure. She couldn't breathe. They canceled the procedure, and she was sent home on hospice. So hospice is usually end-of-life care. Well, she's got a loving daughter and a loving son and a loving husband, And they'd sent her home on hospice, but they were giving loving care of her. And they were getting up and around and moving and eating. And she was getting stronger. And she was dressing herself and caring for herself. And this week she came to us because she didn't think hospice is the right thing for her. She's doing pretty well and want to know what the options are, what the choices are. That's why people call us. What are the choices? So, believe it or not, this has been going on since October. So October, November, December, January, February. Today is March. And no one ever did a scan. No one ever did a PET scan to see where the cancer was. No one ever did cancer markers. Cancer markers gives us an idea of where the cancer is, the type of cancer, and also how it responds to treatment when we follow it. So all in one day, we saw her. We got a PET scan. We got cancer markers. The family wanted to do a stereotactic body frame, which means to prepare for stereotactic body radiosurgery to hit that cancer. And all within 24 hours, we had the news back, and great news because it's been 5 months since she was diagnosed. Luckily, the cancer's only in the pancreas. It is not spread by the very sensitive PET scan test in a very good facility, outpatient. Cancer marker came back elevated at 10. CEA was 10. So she has a PET scan that shows this mass, an MRI that shows this mass, the elevated cancer marker, and she wishes to be treated. And why wouldn't she? I spoke to her cardiologist. I examined her and found her heart rhythm abnormal. So I spoke to the cardiologist. We conferred. He's known her for a long time. He says, this is the thing to do. Non-invasive, focused treatment for the pancreas cancer, confirmed by the PET scan, confirmed by the cancer marker. And here we are with decades of experience, about 2,000 patients a year, 20,000 patients treated over many years. So we think she's doing the right thing. After all those complications, infections, perforations, abscesses related to surgery, here she is with us, having a choice of hopefully putting that cancer in remission. There was a new report actually in the New York Times this week that looked at whether diabetes drugs are safe or not. About a year ago, there were some reports that diabetes drugs, oral drugs, weren't safe. So there was an unusual paper that was published in New England Journal of Medicine on Thursday this week that was produced by the Food and Drug Administration and the European Medicines Agency that said that assertions by some researchers that drugs that could cause pancreatic inflammation and pancreas cancer were inconsistent with the current data. So these drugs are Genovia, Vitoza, Aglisa, Byetta, Bidurian. These are drugs that help control blood sugar by mimicking or increasing the activity of hormones. So it seems like the drugs are safe. They do not cause cancer. So if you were concerned about that, you can give us a call. We're at 212-CHOICES, 212-CHOICES to talk about any of these topics we talked about today: lung cancer, pancreas cancer, stage 4 cancer, cancers of the brain or tumors of the brain, including meningiomas, acoustic neuromas, pituitary tumors, metastasis. We have booklets and DVDs to send to you. We do that at no charge. You can call us at, again, our number is 212-CHOICES, which is 212-246-4237. If you're in the New York area, we're close to Macy's and Times Square, where 50 million people a year visit. So come by and pick up the information, or we'll send it to you, whatever is most convenient for you. So thank you for listening. Have a great week. Stay warm, stay cozy, and God bless you. This is Dr. Lederman saying see you soon.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
It was my dad, Chester, who taught me the hawk is talking from his days growing up in Chicago. And we miss him dearly, having lost him a year and a half ago, but he lived to 92. But back in 91, he had a unique problem. There was a fungus, a growth in his stomach, strangling his intestines. He went to maritime hospitals. They couldn't figure out a cure. So he went to Dr. Gil Lederman. At that time, a triple board certified Harvard-trained radio-oncologist who obviously wasn't a stomach expert, but he was able to steer my dad in the right direction, an Egyptian-born doctor who was a specialist in this area. And after 6 hours, he was able to remedy a problem that others said couldn't remedy. That's one of the reasons you should consider Dr. Lederman, because his expertise is in treating cancer, especially those people who have already had prior chemo, surgery, or radiation that didn't work, or reoccurring cancers. So if you've tried all other options, you need to go to Dr. Lederman. He's a brain and prostate cancer as well as body cancer expert, breast, lung, pancreas, liver, kidney, and more. All you have to do is call Dr. Lederman at 212-CHOICES. That's 212-CHOICES. He'll send you an informative booklet, DVD, and arrange a prompt meeting. It's one-on-one. You sit down with him at his offices at 38th and Broadway. Takes most insurances, Medicare and Medicaid. Just call Dr. Lederman for your cancer or for someone you know who's in that situation I've described. His treatment, his choices at 212-CHOICES he'll share with you. That's 212-CHOICES. 212-CHOICES.
This is where New York comes to talk. Legendary 77 WABC. New York. A Cumulus station.
77 WABC.
From ABC News, I'm Dave Packer. President Obama responding to reports of Russian military movement in Ukraine, warning Moscow there will be costs if Russia intervenes, but leaders in the